Welcome to Mercy Medical Center's live webinar. I am Lynn Dennis, Program Coordinator, and today's topic is breastfeeding support, close to mothers. Joining us are two international board-certified lactation consultants, Linda Klein, Director of Birthplace, the Neonatal Intensive Care Unit and Pediatrics at Mercy, and Lynn Devine, Registered Nurse. After their discussion, they'll take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow, and your questions will be confidential. Well, I'm very happy to welcome you both to our webinar. We're going to begin with Linda, so I'll turn the mic over to you now so we can go ahead and get started.
Okay, so first we're going to start talking a little bit about the nature of breast milk itself. Most people know that breastfeeding is a very healthy way to feed your baby and give nutrients that babies need to gain weight and develop. But breast milk is a source of natural nutrition that's complete with the perfect mix of vitamins, proteins, ideal fat for growth and development, and a lot of other nutritional components. Breastfeeding has always been an important part of infants' health. And there are many health benefits that come along with breastfeeding that impact both the mother and the baby. The initial milk that comes in after birth is called colostrum, and it is the milk that the breasts make in the first few days after delivery. It looks a little different than mature milk. It is thick and yellow in color. There isn't a lot of volume in colostrum, but there is plenty enough nutrients and calories to meet your baby's needs in those first few days of life. It's the exact right amount for the baby's tiny stomach. It's estimated that colostrum triggers at least 50 processes in the baby's body. It is very nutritious for the baby and helps the digestive tract develop, and also helps the tract to prepare for the breast milk that's going to come after the colostrum. Colostrum is also full of many different immunities, and these are transferred from the mother to the baby, giving the baby its first immunization, so to speak. Breast milk is perfectly matched nutrition for the human baby. It has a perfect mix of vitamins, protein, and fat, which are all the baby needs to grow and develop. There is not a formula made that can match the unique makeup of human breast milk. And I like to think about human breast milk as actually being alive with living cells, whereas formula is something that is mixed up and doesn't contain those living cells that actually are very beneficial for babies. Breast milk is also easier for the baby to digest, easier to digest than formula, especially for premature babies. Breast milk has antibodies that help your baby fight off viruses and bacteria. And the American Academy of Pediatrics says that breastfeeding can play a role in the prevention of sudden infant death syndrome, which leads to lower mortality rates in infants who are breastfed. Babies who are exclusively breastfed for the first 6 months have fewer ear infections, respiratory illnesses, and have diarrhea less often. It also reduces the baby's risk of having allergies or asthma. So I always encourage families who have allergies in their family or history of asthma to really consider breastfeeding, because it does reduce the risk that the baby will develop that later in life. Babies who are breastfed have fewer hospitalizations and trips to the doctor. And the actual act of breastfeeding is beneficial to the baby because of the physical closeness with skin-to-skin contact. It helps the baby feel safe and secure. And there are also quite a few studies to support the actual breast in the baby's mouth help to form a broader palate, so there's less likelihood of a need for braces or intervention with teeth as the child gets older. Breastfed babies are more likely to have a higher IQ later in life and also more likely to maintain a healthier body weight. Some research even suggests that breastfeeding has links in less cancers and such things as diabetes and obesity later in life. There's also numerous benefits for the mother. Breastfeeding makes the uterus contract, which in turn shrinks the uterus back to its normal size more quickly. Breastfeeding exclusively burns about 300 to 500 calories per day on average. So this really can help mothers return to their pre-pregnancy body and weight, which for most women is very desirable. There is a link between breastfeeding and decreased risk of ovarian cancer, breast cancer, and type 2 diabetes in the mother. And breastfeeding is emotionally and physically very positive and a good positive feeling for both the mother and the baby. There's also a decreased risk of postpartum depression in mothers who breastfeed. And most people find that once they get over the initial challenges, breastfeeding is much more convenient. It's always on hand. There's no preparation needed. There's no dishes to wash, and it's always the right temperature for the baby. Breastfeeding can also save you money. Formula feeding costs around $1,500 to $2,000 per year, and breast milk is virtually free. It's also important to know that mothers who breastfeed miss less work overall due to healthier babies and less hospitalizations. There are some common challenges that occur with breastfeeding. There are some common challenges that occur with breastfeeding, and it's important to be aware that if you encounter some bumps along the way, don't give up. Most mothers have some sort of bump in the road while breastfeeding. This is very normal. There are many resources available to help you overcome any issues or problems that you may have. Some common challenges include going back to work, challenges with sore nipples, engorgement. Some people are a little challenged or feel uncomfortable with breastfeeding in public, don't have the support system behind them, and truly, if there are going to be bumps along the way, but if you find the right support, almost everything has an easy resolution, so don't give up on your journey. Going back to work is one of the first challenges that moms encounter as they are making their journey with breastfeeding. It's good when you're going back to work to consider taking off as many weeks as you are allowed and you can afford. And be sure you get a good breast pump, and if possible, have some supply stored up. Pumps that allow both breasts to pump at the same time will save you a lot of time and also are more effective in removing the milk from the breast. Make sure to talk to your employer beforehand to make sure you have a place and time to breastfeed during the day. The Affordable Care Act supports work-based efforts to assist with nursing mothers. Introduce your baby to a bottle nipple at least a few days prior before going back to work so that your baby is comfortable being fed by someone else. And make sure when you are going back to work that you have a comfortable place to pump and a place to store your milk. Most pumps will come with a cooler pad. Some of the things that can help you while you're breastfeeding at work. One is to consider pumping milk at the times that you would normally feed your baby, if at all possible. This will help you to maintain your supply. Pump enough times that your baby will have food for all of its regular feedings. And it may take you time to adjust to pumping in a work environment. So make pumping easier by doing things such as massaging your breasts, gently rubbing your nipples, thinking about your baby, or even bringing a picture of your baby. Sometimes these things help make pumping easier at work. Other people find that if they bring something that smells like their baby, maybe a t-shirt that the baby wore, can be very useful in helping your milk come down. And most breast pumps do come with a cooler, but if not, make sure that you do have a place to store your breast milk and label and date each breast milk bottle or package. I'm going to turn this presentation over to Lynn, and she's going to talk a little bit about sore nipples.
Hi. Well, sore nipples and engorgement are often something that occurs with breastfeeding. It's common to have some nipple tenderness when you first start nursing. The correct latch is very important to avoid sore nipples. So if someone were to develop sore nipples, the number one thing is to correct your latch. The other thing to remember is to go ahead and express your own milk and gently spread it on your nipples before and after nursing.
Occasionally, use of a lanolin ointment has helped some mothers to keep their nipples nice and soft and keep them from cracking. If you develop more problems, it's important to contact a certified lactation consultant for further assistance. Engorgement can happen usually approximately 2 to 5 days after you've delivered your baby. It's very common to feel heavier, larger, and a little tender in the beginning, and that's when your body's in the process of increasing that milk supply. Sometimes that fullness turns into engorgement, where your breasts become hard and swollen, throbbing, lumpy, and uncomfortable, and sometimes even painful. It's common also for moms to run a low fever as well. Engorgement can also lead to plugged milk ducts or a breast infection. So it is important to prevent those things before they even happen. The number one thing to prevent it is frequent nursing. The more you empty your breasts, the more you will keep yourself from developing engorgement. If you do get it, warm compresses before nursing and or pumping is very helpful in opening up those ducts. You can also gently massage the firm areas in your breast to express a little bit of the milk, also to soften up your breast, areola, and nipple before having your baby latch on. In between nursing or pumping, you can put cold compresses on your breast to help with the inflammation. Have the baby nurse on the side that is most engorged, and then you can also pump on that side as well. It's also important to wear a well-fitted bra that is supportive and not too tight. It will help to ease that discomfort. A big concern with breastfeeding is, will I make enough milk for my baby? The most important thing to remember is the more you empty your breasts, the more you will make. Most mothers make plenty of milk for their baby, but the problem often occurs when milk is not being emptied enough. So it's important that you're nursing your baby at least 8 to 12 times in 24 hours, that you're nursing for 10 to 30, even more, and make sure you're emptying your breast with each feeding. Low milk supply can occur if there's not enough nursing involved. 6 to 8 weeks after your delivery, your breast may no longer feel full, and this is a normal occurrence. Babies are also more efficient at removing the milk from the breast, and they can do it within 5 to 10 minutes. You will also notice that babies go through growth spurts. It can happen around 2 to 3 weeks, 6 weeks, and possibly 3 months of age. When this happens, they're going to want to nurse for longer periods of time and more frequently. But don't worry, because this frequent nursing and longer periods of nursing are going to help to increase that milk supply. So once your supply increases, you'll likely go back to your regular routine. In our early history, breastfeeding was normal and very common. It was expected. But as the United States changed with war and the industrial age, more women started working outside of the home, and with the advent of commercial formula, less women were breastfeeding. So for, probably since the 1940s and 1950s, formula feeding has been the norm. Breasts are often seen in our culture as sexual objects, and so often that makes women feel uncomfortable while breastfeeding in public, and also people who observe her can feel uncomfortable. The most important thing to keep in mind is that you're feeding your baby and you're not doing anything inappropriate. It's important to know that in the state of Iowa, women have the legal right to breastfeed in public. You should never be told that you should go to the restroom to nurse your baby. Remember, you don't eat in a bathroom, and neither should your baby. A poor support system can sometimes be the link between how long a woman breastfeeds. So in retrospect, a good support system is very important. Our society doesn't always support breastfeeding. Studies show that the link between support and the length that the woman breastfeeds is important. Because our culture is ingrained with formula feeding, there's little breastfeeding in public, but it's definitely something that we need to change. Sometimes your friends or family members don't agree with the fact that you're breastfeeding because they don't know the benefits of breastfeeding, or maybe they bottle fed their baby and they feel that their baby's turned out okay, so why would you want to breastfeed? We need to be educating them and explaining to them the benefits of breastfeeding so that you can help them understand your choice. Online, there's a website that talks about 101 reasons to breastfeed your baby. That's a great information piece to put on your coffee table so that when people come over, they can look at that and see all those benefits. Although there are some times when you don't feel supported, there are people and places that you can go to support. Talk to a friend who is breastfed, who's had a successful time at it, and then she can also give you the information and tips that she needed. You can also be a part of a support group. It's a great place to meet other mothers at all stages of breastfeeding. You can surround yourself with women who truly understand and can relate to what you're going through. Support groups can be a relaxed environment where you can share your stories, get advice and knowledge. But remember, it's your choice to breastfeed your baby, nobody else's. And by doing so, you're doing the best thing for yourself and your baby. How to support a breastfeeding mother. The more supportive a partner is, the longer a woman will breastfeed and feel confident in doing so. You need to encourage your partner through good times and through rough times. Your support means the world. By doing so, you can help with housework around the house, especially in the beginning. A breastfeeding woman can often feel overwhelmed with all the time she spends nursing her baby. So if there's help with the chores around the house, even sometimes just getting a glass of water, an extra pillow, rubbing her feet, just letting her know that you're there for her. And oftentimes the partner thinks, well, just because she's breastfeeding the baby, I don't have a whole lot to do with that baby. But, oh, there's so much more than feeding your baby. You can hold that baby close. You can do this skin to skin also just by having the baby snuggle up next to your bare chest and keep them close with a warm blanket. That's very important to do in the first 6 weeks of life. You can bathe your baby. You can burp your baby. You can change the diapers. You can entertain your baby. There's so much that you can do. Once breastfeeding has been established and mom starts to pump a little breast milk, then you can feed your baby with a bottle. And the best time to be able to do that is in the evening when mom feels like her milk supply might be a little low, and then that's a good time to give that baby some milk, especially while she's making dinner or busy doing something. Be patient with your partner. Be patient with each other. Breastfeeding can be exhausting, but it's a very rewarding experience. Mercy has many breastfeeding resources. We have approximately 8 international board certified lactation consultants available 7 days a week. We also offer a prenatal breastfeeding class that meets the 4th Thursday of every month. And we also have a breastfeeding group that meets every Wednesday with a certified lactation consultant and a social worker. And during that group, moms can feel comfortable and relaxed to talk about issues or problems that she may have. There is a scale present to weigh your baby. And mothers of all stages of breastfeeding come to this group where a lot of tips are advised and shared. Thank you for watching our webinar on breastfeeding and the support that can be given. If you have any questions, we would like to answer them for you.
Well, thank you both. And again, to remind our listeners, your questions can be submitted from the box in the upper right-hand corner of your screen. And we'll begin with our first question soon. Oh, our first question came in. Is it really true that babies who are breastfed have higher IQs? I know you mentioned that during the webinar. Who wants to take this question? Lynn?
There have been studies that have shown that babies who receive breast milk rather than formula does increase their IQ. I don't know exactly by how many points because I don't have the study in front of me, but yes, that's a commonality that babies do increase their IQ with breast milk. It's great brain food.
Awesome. If nothing else would motivate someone to breastfeed, that certainly would. Next question that's come in, does health insurance pay for breast pumps? Now I think I'm going to hand this over to Lynn again.
Most important thing to do is to check with your health insurance provider and check if they do provide some refund or money for your breast pump. It's included under the durable medical clause, so you can use it in your flex spending program. We here at Mercy offer 2 different breast pumps, and they are also offered at very low competitive prices compared to other places in the state. We're not selling them to make money. We're selling them to provide them for our people who choose to breastfeed. So check with your insurance company and see if they do cover it, and we will take care of that when you come into the hospital.
All right, thank you. Next question is about asking about the best advice to introduce a breastfed baby to a bottle. The writer asked, I'm going back to work in a few weeks and I haven't offered my baby a bottle yet. I know you touched on this. There's some pros and cons. What really is the best advice on how to make up that decision?
That's a really good question that comes up quite a bit as people are getting ready to go back to work. There's a lot of different theories on this, but probably what I've seen in working with families is you want to wait to introduce a bottle until the baby is breastfeeding very well and breastfeeding is well established. You want to try not to start too early, because if you start too early, then the babies get what could be called nipple confusion. The way that babies get the formula out of a bottle is very different than the way they get the formula out of a breast. They have to work a little bit harder at the breast. So if they get a lot of bottles early on, they get used to that rapid flow and don't want to go back to the breast and work hard to get the milk out. So I always recommend for people to wait at least 2 to 3 weeks before they think about introducing a bottle. From there, there's a lot of different ideas and thoughts on that, but I have seen in practice some people that go ahead and introduce a bottle right away and the baby doesn't want to take it and really fights the bottle. And then I've seen other babies introduced to the bottle within a few days before going back to work and they do just fine. So every baby is very individual, and I think it has to do with how flexible they are as people overall. So I think the main rule of thumb is to wait until breastfeeding is very well established, and then you can go ahead and start introducing a bottle anytime after that. And it's always good if you have someone else feed the bottle to the baby, because the baby won't really understand if you're there that they can't just get the milk in the preferred manner and get it directly from the mom. So have dad or a mother or a sister or somebody try with feeding the baby. And don't be worried or upset if it doesn't go well the first time. The baby really doesn't understand why we have to make a change if this is going so well. So go ahead and give it a try. If it doesn't work, try again in a few days. And most babies in time will learn how to drink from a bottle. Most babies will adapt. It just takes a little bit of time and patience.
That was my thought exactly, patience for the mom with that baby and the dad both. Next question, is it okay to sip on a beer as I start breastfeeding to help release my milk? Lynn, going to take this one? Okay.
Well, years ago, they used to say every time you sat down, have a beer while you're breastfeeding. It will help to increase your milk supply. But because of the fact that alcohol goes directly into your bloodstream and therefore also into your milk stream, it can affect your baby's brain growth and development. So it's not recommended that you are drinking alcohol while you are breastfeeding. Now, it's okay to have an adult beverage occasionally during the time that you're or during that period of time when you are nursing your baby. But you should not do it while you're actually breastfeeding, and you should not nurse if you're feeling the effects of the alcohol. Once you feel normal, you don't feel any effects of the alcohol, it is just fine to go ahead and nurse your baby. However, let's say you've gone out, had a couple of margaritas with girlfriends, you come home and you're feeling a little tipsy, you weren't able to drive, and you feel like you need to nurse your baby because your breasts are full. I think at that time it's important to go ahead and pump your milk and go ahead and dump your milk. And then when you're feeling normal and not inebriated, then you can go ahead and nurse your baby.
If you have questions after the webinar, both Linda and Lynn can be reached at the telephone number on your screen, 319-398-6350. And again, we have their the web address also if you'd like more information about the Birthplace. One last question. You mentioned 101 reasons to breastfeed your baby. Where is this available?
Well, I actually have printed off copies that I include in my prenatal breastfeeding class, but it is possible to go online and just type in 101 reasons to breastfeed your baby, and you should be able to find that site. I think it originally was published in around the year 2000, and if they've updated, I'm sure they have more than 101 reasons. So I think it's really important. You will just be amazed at how many benefits there are for both you and your baby, and I want to encourage you in your decision on whether or not to give your baby the best nutrition they possibly can have, and that is your specially made milk for your specially made baby.
Our next webinar topic is co-occurring disorders in teens. Megan Rose, a chemical dependency counselor from Sedlacek Treatment Center, will discuss adolescent substance abuse on Thursday, September 12th at noon to 1. She will take questions live after that discussion. Now, a tape of today's program will be available at the number that's on the bottom of your screen, or at the address on the bottom of your screen, mercycare.org/live. This should be posted later today. And you can always check this website for information about future webinars and listen to past webinars. If you are interested in future Mercy webinars or events, you may sign up for the Mercy electronic newsletter at www.mercycare.org/e-news. I believe we have covered all the questions submitted to us, but if you have additional concerns or questions, we can be reached, both Linda and Lynn can be reached at the numbers on your screen, 319-398-6350. Thank you for joining us.